In Canada, there are approximately 86,000 people who have spinal cord injury. A spinal cord is bundles of nerves that transmit signals to and from the brain to the rest of the body. It is enclosed in the spine by a bone structure called a vertebral column. A spinal cord injury, SCI for short, is diagnosed as a fracture or a dislocation of the vertebrae. This damages nerve cells within the spinal cord, interfering with the signal pathways between the brain, spinal cord, and the rest of the body. The two most known types of paralysis are the paraplegia and tetraplegia, also known as quadriplegia. Tetraplegia is an injury within the cervical vertebrae which can cause paralysis across all four limbs. Paraplegia is an injury below the first thoracic vertebra. Individuals who have this condition are able to use their upper body. The degree of paralysis is dependent on the type of injury sustained, and individuals who have complete injury have absolutely no motor or sensory function, whereas an incomplete injury, motor and sensory functions are moderately preserved. The limitations related with either of these conditions are physical deconditioning, loss of fitness, and functional independence. These limitations are closely linked with increased sedentary behavior, leading to a higher susceptibility to attaining chronic diseases. From these injuries, activities of daily living are harder to complete and require more energy compared to able-bodied individuals. It is harder to complete activities within the SCI population due to the use of only small muscle groups. For example, a seemingly simple task like getting out of bed may be twice as hard for an individual who has SCI compared to an able body due to the inability to use all four limbs. Daily physical activity is important as it produces immediate and long-term health benefits. It can decrease the risk of developing several illnesses such as type 2 diabetes and cardiovascular diseases. Daily physical activity is important to improve one's quality of life. On March 17, 2011, the Canadian Physical Activity Guideline for Persons with SCI, PAG-SCI for short, was created to address the specific needs of wheelchair-dependent individuals. The guidelines suggest that people with SCI should minimally achieve 20 minutes of aerobic activity at a moderate to vigorous intensity twice a week, as well as resistance training consisting of one set of 8 to 10 repetitions, increased to 3 sets for each exercise. However, current research suggests that the guidelines might not be enough to improve cardiovascular health. The guidelines are a good starting point for individuals with SCI, but it is generalized to include both tetraplegic and paraplegic individuals without addressing the differences between each injury. A spinal cord injury varies from each individual, as some may have higher physical capacity than others. Therefore, one exercise prescription should not be prescribed to all SCI populations. A recommendation to ensure that the guidelines are helpful for all individuals who have SCI is to create separate SCI guidelines for tetraplegic and paraplegic conditions. Some examples of these are the exercise prescriptions viewed on the screen. Exercise is a medicine that will help support health and quality of life within the SCI population.